Nathan, you can start your session.
Yeah. So, please, doctors, very good afternoon. We welcome you all to this webinar. As you all are aware, this webinar is to know more about the missing enzyme in your enzymatic preparation, regular preparation. So, we have with us Dr. Satish Kumar. Dr. Satish Kumar is a MDS periodontist surgeon. He has more than 15 years of experience in perio and implant surgeries. He is a well-known speaker at IDA events and other forums. He has a very successful YouTube channel in name of Kazan Dental with more than 50,000 followers. Dr. Satish has authored two books, The Dental Launchpad and The VDS Launchpad. So we welcome Dr. Satish Kumar. So I hand over the session to Dr. Satish to carry it forward.
Thank you.
Yeah, thank you so much.
So before we begin, मतलब चालू करने से पहले ही, there's this thought which is always nagging me, okay? That we as dentists work in the mornings, work in the evenings, still we take out time to go and listen to lectures in the afternoon. मतलब सुबह भी काम, शाम को भी काम, दोपहर में पढ़ाई. It's like how you're studying for your 10th and 12th. Not just that, we even take time on Saturdays and Sundays to listen and upgrade ourselves. And this is not just with young dentists, it's even senior practitioners who are in practice for 15 years, 20 years, they are still listening so that they learn something new. कुछ तो नया सीखूं मैं, कुछ तो better करूं मेरे practice में. And when you ask कि why is this interest, मतलब इतना क्यों पढ़ते हैं हम लोग, क्यों जानना चाहते हैं, क्यों सीखना चाहते हैं, we get multiple answers. The first answer is I want more patients. मुझे ज़्यादा patients चाहिए. You're not happy with the number of patients you have? Maybe a reason. Or at times you are satisfied, you're completely busy, but still there is this desire to get more patients so that you can treat more number of them. And some say, why I'm doing all this is so that I can provide better quality to my patients and at the end of the day, I can charge them more. मैं ज़्यादा पैसे बना सकता हूँ. It might be for your family, for your friends, for your own lifestyle expenses. The desire to have more money. And the third thing is to have respect in the society. मतलब हम लोग बाहर जाते हैं, you want people to know अच्छा इनका काम अच्छा है. Everyone should talk great about your work, not just your patients, even other dentists, that's your peers, who talk good कि इसका काम बहुत ही अच्छा है. Now, why do we want all this? And for all this, what is extremely important? What do we need? The bottom line is happy patients. So if you have happier patients, automatically they will tell other patients this clinic is good and you will get more patients. If you have happy patients, they will automatically get more treatment done with you or will be willing to pay you more and will be satisfied with your treatment and you earn more income. Once they go outside, these patients are satisfied and you have a respect in your area as well as among dentists that you provide good quality treatment. The bottom line is we as dentists want happy patients. But हमारे patient को क्या चाहिए? What do our patients want? And it's not just one type of patient who walks into our practice. You might have that old uncle walking into your practice with all his teeth dangling. सारे दांत अभी जैसे धक्का मार दो तो गिर जाएंगे. You have those kind of patients. You might have the young IT crowd patients who are earning well, maybe the lawyers, the CAs, who are in the zone where they're lacking time, but they want to still focus on their teeth. And you might also have the children who might come into your clinic who either voluntarily or involuntarily are pulled to their clinic. When they walk in, they might have a small smile in, or they might have that fear as they are walking into your practice. So what do these variety of patients who walk into our practice want? How do we make these patients happy? मोस्ट कॉमनली जब हम लोग डॉक्टर्स मिलके बात करते हैं, हम लोग क्या बोलते हैं पेशेंट्स के बारे में? मेरे पेशेंट को खुश करने के लिए क्या चाहिए? डिस्काउंट, डिस्काउंट और डिस्काउंट. बट आई वांट टू आस्क यू वन थिंग. आपने ऐसे क्लिनिक्स देखे हैं जहां पे बहुत सारे पेशेंट्स हैं पर डॉक्टर अच्छा खासा चार्ज कर रहे हैं, दे आर चार्जिंग अ बॉम्ब. Still the clinic is completely filled. I'm sure वैसे clinics देखे हैं, correct? फिर आपने ऐसे clinics भी देखे होंगे where the charges are absolutely nominal, but the clinic is not doing really well. The doctor is just sitting and hoping that he gets more patients. So ask yourself, is it actually true? क्या ये सही है कि patients को सिर्फ amount दिखता है, सिर्फ charges दिखते हैं? We end up seeing practices who are charging 3 times what you are charging maybe, and they are also packed. Why is that? So basically, discount is not the right answer. Then what? Good treatment. वो patient याद है who walked into your practice where the patient had a root canal done maybe 15 years ago with some other dentist, and there was no GP in it, just थोड़ा सा cleaning किया था or maybe a half GP filled, and patient has no pain in that tooth. You did a root canal, absolutely perfect, 0.5 or 1 mm short of apex, gave a crown, and the patient has pain. Patient आके क्या बोलता है? आपने जो रूट कैनाल किया उसमें दर्द है, जो 15 साल पहले किया था उसमें नहीं है. And imagine you did the best treatment possible and the patient is not satisfied. So patient को ये नहीं समझता है कि 1 mm short of apex, ideal treatment, ideal bite क्या है. So patients is not looking for good treatment हमारे dental terms के perspective पे. तो what do our patients actually want? उनको क्या चाहिए? The answer is simple. They want 3 things. First is function. मुझे खाना खाने आना चाहिए. I shouldn't have any difficulty when I'm chewing my food. Second, it should be aesthetic. मतलब लोग मुझे देख के बोले कि वाह क्या अच्छा स्माइल है. It has to be aesthetic. And third, while getting the treatment or after the treatment, दर्द या तकलीफ नहीं होनी चाहिए. You'll have a lot of patients who are willing to pay anything, but what's their aim is, डॉक्टर साहब ट्रीटमेंट करते वक्त बिल्कुल में पता नहीं चलना चाहिए. So their concern is basically these 3 things: function, aesthetics, and less discomfort. Now we attend a lot of lectures for function and aesthetics, but patient के discomfort during and after treatment करने के लिए how much time do we spend? But do you think that decides what a happy patient is? आपने सुना होगा ना, पेशेंट बोलता है कि मैंने दांत निकाला पता ही नहीं चला, दांत निकालने के बाद भी अगले दिन में सब बिल्कुल ठीक था. एंड देन देयर आर दोस पेशेंट्स हु टेल यू कि दांत निकालने तक 10 दिन तक पेन हो रहा था मुझे. सो इफ यू वांट हैप्पी पेशेंट्स, यू वांट पोस्ट ट्रीटमेंट पेशेंट्स शुड हैव लेस डिस्कम्फर्ट. एंड फॉर दैट हम लोग सालों से व्हाट डू वी प्रिस्क्राइब मेडिसिन्स, एंटीबायोटिक्स एंड पेन किलर्स. व्हाट डू एंटीबायोटिक्स टेक केयर ऑफ? The infection part of it. That is, if there is any profuse infection there, it takes care of that. But usually, जब हम लोग दांत निकालते हैं और the surgery is done, what happens? The infection part is taken care, but what is left? Inflammation, body reaction. उसके लिए हम लोग basically painkillers देते हैं. But inflammation होता क्या है? What is it? If imagine I give a cut in your hand and your body has a response to it, that is known as inflammation. So it can be a response to anything. It can be a response to trauma, chemicals, virus, bacteria, any reaction. कोई भी चीज जो जाके damage करती है. A reaction to that is known as inflammation. Now this inflammation basically has 5 signs. याद है ये फिजियो में सीखा था. That is Ruber, tumor, Dollar, Calor, and functionalacia. Basically heat, swelling, redness, pain, and at times loss of function. Dentistry में we do not see a lot of loss of function unless you're doing a procedure near the third molar and patient has discomfort in opening the mouth. That's the major loss of function which we see. Other than that, we mainly deal with pain and swelling. Yes, there might be little redness. Yes, there might be little increase in temperature if they touch their hand out there. But patient mainly क्या बोलता है? Pain or swelling. These are the 2 common things what happens during an inflammation. तो if you want to take care of something, you should know कि यह होता कैसे है. मुझे अगर ये संभालना है तो ये क्यों होता है, कैसे होता है, you should know it. और ये inflammation basically how many types are there? There are basically 2 types of inflammation. One is acute, मतलब अभी आपने चोट दिया, अभी बॉडी ने रिएक्शन दिया. It can be to anything. It can be to a irritant, burn, trauma, cut, allergic reaction. And then there is chronic, means you're continuously irritating it over a period of time. and that damage keeps on adding up and leads to bigger long term consequences. For example, अगर आप गंदा खाना खाते रहे, what happens? It keeps on traumatizing your intestine and you end up with some illness. You have a high cholesterol diet. You keep on traumatizing your arteries. What do you end up with? Cardiovascular diseases. Similarly, if you do not take care of them, you might end up with even neurological diseases or cancer in long-term inflammation cases. But dentistry में we do not deal with chronic inflammation as such, other than periodontitis. Majority of the treatments what we do is short term inflammatory reaction. हमने ट्रीटमेंट किया, पेशेंट को अभी रिएक्शन हुआ, अभी हमें उसे सॉल्व करना है. सो आर प्राइमरी फोकस इज एक्यूट इन्फ्लेमेशन. अब ये इन्फ्लेमेशन में होता क्या है? लेट्स टेक एन एग्जाम्पल कि आप रास्ते से चल रहे हो, यू आर वॉकिंग इन द ओके, और आपने साइड पे देखा एक एक्सीडेंट हो गया. देयर वाज वन कार व्हिच बैंग्ड इनटू अ स्कूटर. Now, what is the natural instinct? The person who was involved in the accident, if someone is injured, he will take the phone and he will call the ambulance. फिर वो किसको कॉल करेंगे? पुलिस. Now, when this is all happening, other people who are going through the road, जो भी जा रहे हैं वहां से, वो लोग भी अपना गाड़ी वगैरह रोक के देखते हैं कि क्या सीन चालू है. They want to know what is exactly happening out there, and you have an entire crowd which gets formed out there. Now, सेम थिंग हैपेंस इन इन्फ्लेमेशन. बेसिकली वहां पे एक इंजरी होती है. द सेल्स विच आर प्रेजेंट आउट देयर, दे सेंड सर्टेन मीडिएटर्स. दीज आर नोन एज केमिकल मीडिएटर्स. दे माइट बी आइदर साइटोकाइंस और कीमोकाइंस. वो लोग बाकी सेल्स को बुलाते हैं कि ये एरिया को आके साफ करो. So your ambulance and police are basically the things which come and clean up the area and take the entire site in control. These are your inflammatory cells. Similarly, there are various other particles, inflammatory particles, when they are passing by through the plasma, they also enter the site. And that's why you end up having a reaction there or a swelling in that particular area. So what is the aim of the police or the ambulance? Is to stop the people who are walking there and ask them, chalo, aage badhte raho. So basically cleaning up the area. What is the job of the ambulance? All the injured people are taken care of. Similarly, all the inflammatory cells go and take care of all the injured tissue out there. So this is basically what happens in an inflammation. And these mediators, जो मैंने बोला कि जो बाकी लोगों को बुला के आते हैं, वो दो टाइप के होते हैं. One is cell derived, means जो वहां पे लोग खड़े थे, जो एक्सीडेंट में इन्वॉल्व थे, उनका. Second is plasma cell derived. So the plasma cells which were passing through, जो लोग बाजू से जा रहे थे, जिन्होंने वो देख के बाकी लोगों को बुलाया, that is plasma derived. But as dentists, हमें ये फिजियो में क्यों सिखाया गया? Why are we supposed to know कि ये mediator क्यों होता है, chemical mediator, everything? The reason is, this is the one which causes pain, swelling and other signs of inflammation. So knowing them helps you control them. Forget about any regular procedure. अगर पेशेंट आपके पास ट्रॉमा के साथ आया तो क्या होता है उसके मुंह में? इन्फ्लेमेशन. आपने दांत निकाला, आपने क्या किया बॉडी में? इन्फ्लेमेशन. अगर आपने ड्रिल किया इम्प्लांट के लिए, आपने क्या किया? इन्फ्लेमेशन. सो एनी रिएक्शन वी डू इन अ पेशेंट्स माउथ इज बेसिकली कॉजिंग ट्रॉमा. यस, द रीजन वी आर कॉजिंग ट्रॉमा इज ताकि शॉर्ट टर्म पेन होगा, बट लॉन्ग टर्म इट इज गुड फॉर द पेशेंट. इट्स लाइक पेरेंट्स अपने बच्चे को क्यों मारते हैं? ताकि लॉन्ग टर्म बच्चा ठीक हो. वैसे ही you are doing these procedures so that the patient might have pain and discomfort now, but the infection does not increase. You are placing an implant or any other procedure now so that later the patient can chew properly and has a good function out there. You are giving a stitch out there. Yes, you're causing short-term trauma, but your aim is it seals and it heals properly. So this is similar to Salman Khan ka dialogue. मारेंगे भी हम ही, बचाएंगे भी हम ही. So we as dentists, basically our aim is to try and cause short-term trauma but for long-term gains. Now, अगर हमने ट्रॉमा किया तो क्या होने वाला है? पेन और इन्फ्लेमेशन तो होगा ही, स्वेलिंग होगा ही. एज डेंटिस्ट, लोग डेंटिस्ट के पास आने क्यों डरते क्यों है? यू आस्क मेजॉरिटी ऑफ द पीपल, व्हाई डोंट यू गो टू अ डेंटिस्ट? फर्स्ट आंसर इज, आई एम स्कैर्ड ऑफ द डेंटिस्ट because during treatment and after treatment I might end up having pain. So as dentists, our main aim should be to try and control this pain during and after the procedure. So during the procedure हम लोग क्या करते हैं, stitches देते हैं या pack देते हैं. Why? To get hemostasis. Long term in dentistry you cannot do much when it comes to proliferation or remodeling of the bone. So the main area where we need to focus is the inflammatory phase. So for the inflammatory phase, that is where we prescribe medicines. And painkillers are basic NSAIDs. They just reduce the pain out there. Not completely. उनका side effect होता है anti-inflammatory action. Main effect है anti-pyretic, anti-fever. So you want something else which can do complete anti-inflammatory effect. And for that, in today's day and age, we have certain enzymes. And one such combination of enzyme is tolib. Now, why tolib? First thing is it has four useful enzymes which are extremely effective as stated by the company. है कि नहीं वो हम लोग बाद में डिस्कस करेंगे. Second, it comes from a company which has set up across 120 countries. So their medicines are being prescribed across the globe. So you know the quality of enzymes are good. But quality अच्छा है, पर ये enzyme के फायदे हैं क्या? इसमें basically we have four enzymes. First is trypsin, second is bromelain, third is rutoside, and fourth is papin. Now, why each of this enzyme is given? और ये चार enzymes क्यों है? Why not have only one? Why overload the patient with four enzymes? Let's discuss one by one. First is trypsin. Now, trypsin, याद है फिजियो में पढ़ा था trypsinogen करके there was a constituent made in the body that enters into the duodenum through the pancreatic duct. वहाँ पे it breaks down into trypsin. So trypsin is basically already made by the body. If something is already made by the body, why do you prescribe it? What is the use of it? It basically has three functions or three uses. The first is it inhibits vascular permeability. Remember जब मैं बोला था जब accident होता है, all the people on the road come onto the site. So what does trypsin do? It prevents all these extra cells present in the plasma to enter into the site, reducing swelling out there. Second, remember I told you to do phone call and call all your friends? This basically reduces the mediator action of tumor necrosis factor alpha, interleukin 1 beta, and others. So by this, it reduces all the swelling which is seen in the initial phase. Second, अगर आपके घर पे कुछ डैमेज हुआ या क्लिनिक में डैमेज हुआ, imagine there's a hole in the wall, okay? What would you do? You would call people to come and repair the site. Imagine उन्होंने repair कर लिया and they leave all their tools, the excessive cement, everything debris out there and they leave. How will it look? Bad, right? Similarly, when there is a trauma, you have fibrin which comes there. You have a clot formation which happens out there, which is actually good, जो वो पूरे एरिया को tightly seal करता है. But afterwards, you basically want the excessive production out there to be cleared out. So for that, you need an activity known as fibrinolysis, जो fibrin को पूरा निकाल दे काम होने के बाद. So trypsin helps in doing that. It cleans up that area once the initial clot and the healing happens. So it prevents excessive inflammation and pain due to it, which is caused. So we know trypsin is advantageous. Theoretically तो इतने सारे फायदे हैं, but practically किसी ने दिया है क्या? And the answer is जो medical doctors है, जो हमारे medical counterparts है, उन्होंने ये trypsin बहुत टाइम से patients को दे रहे हैं. They are giving it for various purposes like ulcers, rheumatoid arthritis, and even ocular or eye disorders basically. And they have seen that trypsin helps in better healing. It helps in removing necrotic tissue which is formed out there. So we know it has good activity. Second, we know that हमारे जो medical counterparts है वो लोग already दे रहे हैं. Then what is stopping us dentists from using trypsin? Second, after trypsin comes bromelain. Now bromelain is found basically from pineapple. So it is absolutely safe जो हम लोग खाते हैं. ठीक है, but why you to take an enzyme from a fruit and give it to your patients? The answer is bromelain has multiple actions. First is it has inhibition of pro-inflammatory mediators. जो मैंने आपको स्टार्टिंग में बोला था, जो फोन कॉल्स जाते हैं लोगों को बुलाते हैं, those chemical mediators are taken care by bromelain. Second, initially there is some amount of clot formation which happens, but you do not want excessive clot formation, you do not want excessive fibrin activity. In that terms, bromelain prevents platelet aggregation. मतलब it prevents excessive fibrin layer formation in the start itself. Then it also acts by suppressing certain cytokines like interleukin 1, tumor necrosis factor alpha. So, bromelain overall helps prevent excessive inflammation at the start, and if it occurs, helps reduce it. But similar to trypsin, is it useful? Theory के लिए सब अच्छा है, practically useful है क्या? And the answer is bromelain has been used consistently by doctors. For example, एक study किया गया था where they prescribed bromelain before surgery in a sports injury case, and they saw the healing is better post surgery if bromelain was prescribed. Not just that, it has been used in other situations like chronic inflammation, malignant tumors, and autoimmune diseases. And they have seen bromelain helps reduce inflammation. तो एक दवाई है जो बाकी डॉक्टर्स दे रहे हैं, जो काम आ रहा है. Then why are we dentists not using it to improve our patient's life post procedure? Then comes the third enzyme, rutoside. Now this is found again in natural structures like apple, buckwheat and tea. हम लोग वापस ये सब लेके एंजाइम क्यों निकाल रहे हैं? Again, long list of advantages. It reduces platelet aggregation, decreases vascular permeability, improves blood flow in that area. So if there is any swelling, any debris which is formed, it helps clean up that area. It strengthens the capillaries so that excessive trauma जो हुआ है, you do not have cells moving from the plasma into the tissue site. Other than that, it is also said to release nitric oxide, which prevents free radical activity. So now, similar to the previous two enzymes, rutoside patients में देना है क्या? And the answer is it has been used commonly in arthritis cases and in other inflammatory diseases. So why not prescribe rutoside? Now this first three enzymes जो हमने discuss किया था, you would find them with certain enzyme combinations. मतलब ऐसे medicines हैं market में जिनमें ये तीन enzyme हैं. But अगर मैं बोलूँ कि ये तीन enzyme तो अच्छा है, there is one additional enzyme if you add which no other drug in the market currently provides, is more beneficial and has more effect. What would you say? If I tell you आपका सर्जरी हुआ है और आपको तीन दवाई नहीं, मैं एक चौथा एक्स्ट्रा दूंगा पर उससे बहुत ज्यादा पेन रिलीफ होगा, क्या आप लोगे? एब्सोल्युटली यस. नो? तो आप अपने पेशेंट्स को क्यों नहीं दे रहे हो? एंड दैट एंजाइम इज पैपेन. नाउ पैपेन आपने पाइनएप्पल देखा होगा व्हेन इट इज ऑन द ट्री, इट इज कंप्लीटली ग्रीनिश इन कलर. व्हाट दे डू इज वो लोग एक कट मारते हैं उस पे एंड देयर इज अ व्हाइटिश फ्लूइड व्हिच ओजेस आउट व्हिच इज नोन एज लेटेक्स. उसके लेटेक्स में से वो लोग ये क्रश करके एंजाइम निकालते हैं. दैट इज नोन एज पैपेन. एंड पैपेन, इफ यू इवन गो इनटू द लिस्ट, कि वो बहुत ही लंबा लिस्ट है कि वो इन्फ्लेमेशन कैसे कम करता है. फर्स्ट इज ब्लड वेसल स्ट्रेंथन. सेकेंड, एंटी इन्फ्लेमेटरी रिएक्शन और मीडिएटर्स को कम करता है. थर्ड, एंटीऑक्सीडेंट प्रॉपर्टीज भी है उसमें. एंड फोर्थ, it improves microcirculation, so if any debris are corrected due to the fibrinolytic activity is quickly taken care of. And similar to the three enzymes, papain is a proven enzyme. It has been used not just in sports injuries but in various ulcers like leg ulcers and pressure ulcers, even in diabetic conditions and in burns. So the advantage of papain is multifold. And हाउ वी से क्रिकेट में एक प्लेयर कितना भी मारे, पूरा टीम साथ में जमना चाहिए. Similarly, it has been proven that giving these four enzymes together is more effective rather than giving one, two, or three of them. Like I said, market में पहले तीन का combination मिलेगा, but all four, the synergistic activity is not found other than in Tolib. अगर आप बोलोगे कि हाँ मेडिकल डॉक्टर्स तो दे रहे हैं, बाकी सब लोग दे रहे हैं, बट डेंटिस्ट्री में काम आएगा क्या? एज अ डेंटिस्ट आई एम रिसर्च बेस्ड, मुझे जानना है कि मेरे पेशेंट को फायदा हो तो ही मैं एक एक्स्ट्रा दवाई लिख के दूंगा, अदरवाइज आई विल नॉट प्रिस्क्राइब एनीथिंग मोर. व्हाई शुड आई इंक्रीज द कॉस्ट ऑफ माई पेशेंट्स? Absolutely reasonable and right question. The answer is, how would you identify Tolib is effective or not? आप आपके क्लिनिक में 10 पेशेंट को टॉलिब दोगे, 10 पेशेंट को टॉलिब नहीं दोगे, 20 पेशेंट में सिमिलर ट्रीटमेंट होना चाहिए. मतलब 20 में फॉर एग्जांपल अक्कल दाढ़ निकाल दिया आपने और द विजडम टूथ एक्सट्रैक्शन हैज बीन डन, एंड देन यू हैव टू सी which set of patients has better healing. If all the patients heal equally well, then Tolib is not effective. Correct? Similarly, to prove the efficacy of Tolib, सविता डेंटल कॉलेज में एक सिमिलर स्टडी हुआ था. They found 60 patients who required third molar or surgical extractions. 30 patients were given normal antibiotic painkiller. 30 were prescribed antibiotic painkillers with Tolib. And later, the healing, the inflammatory signs, and the patient response was asked. It was seen all the patients who had Tolib, on an average, had better response post surgery. There is something known to determine pain. उसको हम लोग बोलते हैं VAS score, कि patient बोलता है कि 1 to 10 में how much pain they have basically. And it was seen all the patients who had taken Tolib on an average gave better results post surgery as compared to those patients who were not given Tolib. So here you have a medicine which we know is not just effective in theory, not just effective for medical practitioners, but is also proven clinically when it comes to dental cases. Your next point will be, okay, I understood it is useful, but dena kab hai? You should give it in all cases where you're expecting excessive inflammation. That can be extractions, third molar surgeries, jaw fractures, disimpactions, might be canine disimpactions, laser surgeries, implants, grafting. Now that we know कब prescribe करना है, dosage क्या है, they state that the dosage is twice daily as long as needed. But as dentist, we should understand as long as मतलब क्या, lifelong थोड़ी देने वाले. We won't, right? If you do an extraction, how long does the pain last? 5 days. If you feel it's a simple extraction, give it 5 days. Twice daily, 5 days. If you're doing a disimpaction, you know कि ये patient में trauma हुआ है थोड़ा सा extraction में, patient को 7-10 दिन को दुखने वाला है, give it for 7 to 10 days. You're doing a major GBR, give it for 10 days. So wherever you feel how much time roughly it takes for healing, add this twice daily for those many days. So the average range can be from 5 days to 15 days in major surgeries. Minor procedures, 5 days is more than enough. अभी हमें पता है कि टॉलिब देना कहाँ पे, बट आंसर क्वेश्चन ये होगा कि when should you not prescribe it, या इसका साइड रिएक्शन क्या है. What happens if you take टॉलिब? Is there any side reaction? I hope you remember आपका pharmac, when they used to ask you what is the side effect of these medicines, and what used to be our answer? Nausea, vomiting, diarrhea. Correct? Similarly, Tolib का भी major side effect is nausea, vomiting, diarrhea. Some people might rarely say कि थोड़ा सा giddy हो रहा है. If they have such a thing, you can tell them to stop taking the medicines. But this is extremely rare. Now, in which cases you should not prescribe Tolib? There are two conditions which is actual contraindications. First is if the patient is having blood thinning medicines like warfarin. याद है हमने स्टार्टिंग में बात किया था, ब्रोमेलिन prevents fibrin formation, prevents excessive clot formation. Imagine the patient is already taking blood thinners जहाँ पे clot हो ही नहीं रहा है. You add this, is you going to get a clot? No. So where you want a clot, you're not going to prescribe this. So if the patient is on a blood thinner, avoid. Second, if the patient is taking sedatives, avoid this. Then there is one contraindication which is actually not a contraindication, that is pregnancy and lactation. Why I personally will tell you not to give it in pregnancy and lactation is because we do not have enough research saying कि ये absolutely safe है, तो risk क्यों उठाना है? There is no studies which is saying कि it is extremely harmful, but we are not still sure about the safety. So for now, it is better not to prescribe Tolib in pregnant women and lactating women, and strictly don't prescribe it in those who are having sedatives or on blood thinners. Other than this, you should always prescribe Tolib where you feel the patient might have inflammation. Because हमने स्टार्टिंग में क्या डिस्कस किया था? What do we all want? Either money or more patience or respect. From where does that come? By happy patients. Happy patients को क्या चाहिए? तीन चीजें: function, aesthetics and less discomfort. And for less discomfort, you need less pain and inflammation after the procedure. So by adding one enzyme, if you can get that, why not prescribe? Second, why I would prefer a drug like Tolib rather than other options out there? Because recently आपने वो पढ़ा होगा एक किस्सा. The doctor prescribed syrup and a lot of people, kids ended up dying. The reason being, there are a lot of shady generic companies out there. The advantage of prescribing Tolib is it comes from hetero healthcare, who not just create drugs for our country, but provides them to 120 countries around the world. It is a standard company and has reasonable years of experience. They have scientific literature before they create a product. So giving a product from a company which I personally would be okay taking is something I am okay prescribing my patients as well. When it can help them heal faster, make them happier, and eventually make me happier. So with that, I would like to end today's session, and if you have any questions, we'll take them now. So if there are any questions,
Participating doctors, if you have any questions, you can just type in the chat box. Any doubts, any questions you want to ask, you can type in the chat box. Dr. Satish Kumar will answer it. I guess so far so good. So thank you, Dr. Satish, for this wonderful, insightful, and detailed webinar. I hope most of the doubts, questions, and any ambiguity about the molecule will get resolved. Thank you so much for your time as well. Thank you, doctors, for participating. Wishing everyone a very happy Diwali and a prosperous New Year. Thank you so much for coming here. Thank you. We end the session here. Yeah.